Hello everyone, I am student nurse Angelica Contreras from BSN 212I Group 2. Today I'm going to demonstrate female catheterization. We do this to determine accurate measurement or urinary drainage in critically ill patients and also to drain urine pre-operatively and post-operatively. So first, we're going to check the doctor's order sheet for the order of catheterization. Okay. So after cathetering, the doctor didn't order any sample to be tested. So next is before we prepare the set, we need to wash our hand to deter the spreading of microorganisms. Now we're going to prepare the equipment needed, such as indwelling catheter, sterile cotton balls with betadine, sterile lubricant, urinary bag, 10 cc of syringe with sterile water, pickup forceps, gloves, 2 sets of gloves, bath blanket, and draw sheet. We're also going to prepare hypoallergenic tape, eye sheet, and also waste receptacle. Now let's meet our client. So first is we are going to introduce ourselves to the client. I verify the client's identity. This is to ensure that we have the correct client. We are also going to explain the procedure to the client so that she is aware of what we are going to do and she can cooperate comfortably throughout the procedure. Hello ma'am, good morning. I am student nurse Angelica Contreras from Davao Doctors College. Can I check your wristband to verify your identity? Okay, can you please state your full name and date of birth?
So my name is Angelica. My date of birth is November 18, 2002.
Okay, thank you. And how would you like me to address you?
Just call me Mel.
Okay, Mel, are you with someone right now? So
No.
Mel, do you know what are we going to do today?
Yes, we are going to put a urinary bag to my vagina.
Okay, so today I'm going to insert a catheter in your private area. This will involve me touching your private area and also exposing it. Is that all right with you?
Yes.
Okay, so rest assured that no one else can see you because I have already secured your privacy. I have locked the door and closed the curtain, okay?
Okay.
So before we start, do you want anything else or are you uncomfortable somewhere?
No, I'm fine.
Okay. So it is important to secure the privacy of the client so that she is comfortable throughout the procedure and no one else can see us while doing this procedure. For minimum exposure and to lessen the embarrassment of the client and also to provide warmth, we are going to drape the client. It is important to provide privacy to the client so that she can be comfortable throughout the procedure. Next is we're going to position the client in a dorsal recumbent with the knees flexed. This is to provide patient's comfort. Mel, can you please flex your knees? Are you comfortable?
Yes.
Okay. So, for a better visualization, we're going to apply direct light in genital area while doing the procedure. Next is we're going to open the tray and arrange the equipment for convenience and accordingly to avoid contamination of sterile equipments or items. We're going to place the equipment in order so that it will increase the speed of our performance. So I have already arranged the equipment earlier to save time. Now to avoid the bed getting soiled, we're going to place a rubber sheet below the hip of the patient. Now, please raise your hip. Wait for a while. Okay, please raise your hip. Now we're going to expose the private area of the client. We're going to use the eye sheet to cover the other areas. We're only to expose the area that we will be doing the procedure. Before putting the eye sheet, we're going to wear gloves to avoid cross-contamination of microorganisms. Now that we are done wearing gloves, we're going to cleanse the meatus and the surroundings of the meatus by using a cotton ball with betadine. Now we're going to place the eye sheet and lubricate the catheter. So we're going to lubricate the catheter for about 1 inches, being careful not to plug the eye of the catheter. And we're going to use the lubricant, sterile lubricant. Using this lubricant reduces friction, so that urine will flow out of the catheter if lumen is not occluded. Next is we're going to pick up the catheter at least 3 inches from the tip of the thumb and 1 finger of the left or right hand between the levis minora. Then, we're going to separate and pull up gently, separating the area and provide space or visibility. Then, we're going to insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. So, female urethra is approximately 1½ to 2½ inches. Next is, if a specimen is to be collected, we're going to pinch the catheter with the thumb and the finger while placing the specimen container in position, if only needed or it is written in the doctor's. Then we're going to rest the hand in the pubis area while holding the catheter in place to prevent from pulling and pushing of the catheter. Because withdrawing the catheter and pushing it back in the urethra increases the possibility of infection. Next is we're going to connect the catheter to the urine bag. Next is we're going to hook or put the urine bag below the bed, or it should be below the patient. So we're going to hook it here. Next is we're going to inflate the balloon 10 to 15 cc of sterile water using a 10 to 15 20 cc syringe. After inflating it, we're going to secure the indwelling catheter by taping it to the patient's thigh. It will allow some slack of the tubing to accommodate the patient's movement. So we're going to use a hypoallergenic tape. After taping it, we're going to place the patient back comfortably. Okay, Mel, you can now, okay. Now we are done. After doing it, we're going to remove the gloves that we are wearing and directly dispose it. Then we're going to do the aftercare of the equipment that we have used. And then, if there is an order in the doctor's order sheet that we should send a laboratory sample or urine sample in the lab, we're going to do it if only there is a request. And then, we're going to record the time, and then we're going to record the procedure of the time and then we're going to record the time of the procedure done, the quality of the urine, the amount, the color, and other things like that. And then always remember that after doing this procedure, we need to perform hand washing to deter the spreading of microorganisms.